official side event of the Nutrition for Growth Summit, hosted by Japan International Cooperation Agency, or JICA, and co-hosted by UNICEF. I am Tomomi Ibi from JICA, being a moderator today. The event aims to discuss, as titled as Empowering Every Child for Healthier Future, Potential of School Feeding and Nutrition Education. In order to realize lifelong health and well-being, nutrition services must be provided in an integrated way with maternal and child health services, particularly in the first 1,000 days. With the growth of children, it's important to create an environment that overcomes malnutrition by providing cross-sectoral nutritional interventions, not only at home, but also in communities, schools, and workplace. Based on this idea, today we will discuss the ideal way of nutritional services, mainly for mothers and children in the first session, inviting 3 speakers from JICA, Gun Health Service, and UNICEF. In the second session, we will also share issues and countermeasures to promote nutrition education and school feeding that can ensure healthy eating habits. We have 3 speakers from University of Auckland, Mongolia, and Tanzania. There will be a Q&A session after each speaker's panel discussion. As an introduction of the sessions, we are showing a short video which explains maternal and child nutrition and nutrition education, or Shokuiku in Japan.
In Japan, nutrition improvement is provided at every life stage, from the prenatal period to old age, through prenatal checkups, infant health checkups, the school lunch program, and general health checkups. People come to the municipal health center every day to pick up their maternal child health handbooks. The MCH Handbook is a very important tool for keeping a continuous record of health and nutrition through a mother's pregnancy and a child's infancy. In addition to medical and health service records, it includes the history of the mother's health during pregnancy, as well as the child's health and growth. It also contains tips on infant care, including breastfeeding, complementary feeding, preventing home accidents, and first aid. There is a wealth of other information about diet and nutrition during pregnancy, postnatal, and lactating periods. After the birth, infants and young children receive several health checkups. Professionals from multiple disciplines check infants and children of the same age on their development, nutrition, and the presence of any congenital illnesses. These checkups help families receive appropriate support, including mental health care if required. It is a valuable opportunity for mothers and fathers to consult with physicians and public health nurses about any concerns they may have had in relation to caring for their child. Providing appropriate nutritional advice for each developmental stage of infants and young children is also important. Breastfeeding and complementary feeding are extremely important stages for an infant's health. It is vital that healthcare professionals support parents who are unfamiliar with breastfeeding and complementary feeding.
乳児健診、幼児健診、そして保育園、幼稚園、小学校、中学校、それぞれの場面で栄養が子ども、生徒、まさに健康の基本の基であるというところを繰り返したくさんの皆さんに関わってもらって、身に染みつける、そういうふうになることを願って、専門職、地域の皆さん、サポートをしているというのが日本の実情です。
At this nursery school, the children go out in autumn to experience digging up sweet potatoes. Children look forward to this fun event. The aim is to have them develop a greater interest in food by coming into direct contact with ingredients and to learn the importance of food. Starting when they are still small, children in Japan obtain knowledge on food and nutrition as well as acquire healthy eating habits through such food and nutrition education, or Shokuiku. In elementary school, at lunchtime, the children first wash their hands. Those on lunch duty wear appropriate attire and prepare to serve lunch. Once the lunch trays are ready, the children come and collect them. The menu changes daily. However, school lunches always include a staple food, main dish, and side dish. These three elements are the basics for considering the nutritional balance of a single meal. Diet and nutrition teachers, or registered dietitians with teaching licenses, are assigned to schools. They are responsible for Shokuiku at school and in the integrated management of the school lunch program, including Shokuiku, menu preparation, and hygiene control.
限られた予算の中で、この学校の子どもたちにはどんな栄養が足りないかなっていうのを念頭に置きながら、この学校の児童に不足しがちなもの、この学校の子が好きなものを考えながら献立を立てています。
栄養不良を改善するっていうことはですね、17項目の全ての底辺を支えることになるということが分かってきたわけですね。したがって SDGs の実現にとって一番大事なことは栄養であると僕は思っています。
Goal 2 of the 17 Sustainable Development Goals, which were adopted by the United Nations in 2015, is zero hunger. It aims to eradicate all forms of hunger and malnutrition by 2030. This is a goal that will be key for the achievement of all Sustainable Development Goals. JICA leverages Japan's knowledge and engages in nutrition improvement activities in developing countries and regions, aiming at health and well-being of mothers and children, as well as all people in the community.
With the concept shown in this video in mind, let us go to the first session on maternal and child nutrition in the first 1,000 days. Please welcome the first speaker, Dr. Nomura, JICA Senior Advisor of Health and Nutrition. Dr. Nomura, the floor is yours.
Okay, thank you very much, Ms. Ibi. Good morning, good afternoon, and good evening, everyone. My name is Marika Nomura. I'm a Senior Advisor on Nutrition and Health at JICA headquarters. Excuse me, just a moment, please. The next 7 minutes, I will be focused on the JICA's nutrition cooperation based on the global trends and the Japanese experiences. Next, please. Let's take a look at the global trends in nutrition prior to the SDGs. The global community worked on the MDGs, Millennium Development Goals, consisting of 8 goals and focusing on maternal and child survival, infectious diseases, and poverty reductions in developing countries. In 2008, The Lancet, the Maternal and Child Undernutrition series, introduced the importance of the first 1,000 days and 13 evidence-based nutrition interventions. In 2010, Scaling Up Nutrition SUN framework was launched, and in 2013, new nutrition agenda and the numeric targets became more global attention to the nutrition challenges in the world. Next, please. As we are already aware, the world is in the midst of the nutrition transition from undernutrition to overnutrition. The double burden or triple burden of malnutrition that is occurring in the process needs to be addressed. There has been a re-emergence of the need to engage in a comprehensive approach or multi-sectoral approach to these complicated nutrition challenges. Next, please. For example, taking stunting as an example, we analyzed which combinations are more effective in multi-sectoral interventions. The analysis used the DHS data from 24 countries, from African countries and Asian countries, grouped the indicators into 3 categories: agriculture, health, and wash, then examined the relationship between each sector and the stunting. The results showed that as the number of sectors of intervention increased, the positive effect of reducing stunting increased. The study also found in addressing stunting through multi-sectoral approaches, a combination of several other sectors with health sector playing a leading role can be effective. Next, please. So, what experience does Japan have and what contributions can Japan make? In Japan, the infant mortality rate has been declining continuously since before the World War II. Even after the World War II, it continued to drop without a sharp increase and is now one of the lowest in the world. And as we all know, Japan has the longest life expectancy average for men and women in the world. Next, please. Furthermore, Japan has one of the lowest obesity rate among OECD countries, both for adults and children, while overcoming undernutrition from the post-war period of food shortages and experiencing the nutrition transition. It is now keeping obesity low. Such a country is very rare in the world. Next, please. As the video shows, in Japan, maternal and child health nutrition services are provided intensively in the first 1,000 days of life, followed by the school-based meal and the food and nutrition education we call Shokuiku in Japanese language in preschool, school age, and adolescence. In Japan, food and nutrition education, Shokuiku, is present in every aspect of our lifestyles throughout our lives. In this environment, the Japanese society can often make healthy diet choices. Next, please. So we, JICA, have been providing nutrition cooperation by integrating nutrition into universal health coverage through 3 main approaches. The first is realization of healthy the first 1,000 days. We are promoting maternal and child nutrition integrated into the continuum of care, COC, by effective use of the MCH handbook, which is initiated in Japan. The second is community-based primary health care. For universal health coverage, where no one left behind, we will strengthen primary health care by fostering volunteers and strengthening outreach services in the community. The third is promotion of healthy diet. To address all forms of malnutrition, we promote obesity prevention and NCD prevention in various settings such as schools, workplaces, and communities in order to promote healthy diet. Next, please. So nutrition is not a new issue, but as the socio-economic environment changes, the issues, approaches, and directions that need to be addressed are changing. Unlike the era of the Millennium Development Goals, for the achievement Sustainable Development Goals, we need to improve nutrition to maximize growth and development for the future potential of children. So this is how the nutritional agenda has changed. Next, please. Nutrition issues are becoming more and more complex. JICA will address nutrition issues and multi-sectoral and multi-stakeholder approach, bringing together the efforts of all sectors within JICA and collective experiences of Japan and the knowledge and experiences of the global nutrition community. So this is all for my presentation. Thank you very much, Ms. Ibi. Back to you.
Thank you, Dr. Namura, for your comprehensive presentation, which shows overview of global nutrition trends and also introduce Japan's experience. It seems applicable to low and middle income countries. So next, we will hear the good practice from Ghana. Ms. Amorfo is Director of Nutrition and Country Lead for Nutrition, the Ghana Health Service. So, Ms. Amorfo, the floor is yours for 7 minutes.
Right. Hello, everybody. Please, would you share my screen, please? Share my presentation, please. Thank you very much. Hello again. I bring you very warm greetings from Accra. My name is Esiforiwa Amwafo, Director of Nutrition for the Ghana Health Service. And I'm going to share a few slides in connection with work that we have done to integrate nutrition into the ongoing work on improving universal health coverage in Ghana. Next slide, please. So by way of introduction and setting a context, as you can see, we are still grappling with a number of nutrition challenges. Prominent among this is stunting, and this has wide disparities across the country and stands at 18%. We are seeing increasing burden of overweight and obesity, and the more underlying conditions are the decline in feeding rates and poor diet quality. Next one, please. So for us to achieve what we have been able to do, we have adopted a multi-pronged approach, and this has looked at actions that will bridge the disparity gaps, especially regarding equity in access to quality nutrition and healthcare. We have prioritized and done a lot of advocacy actions to include key nutrition intervention into the Ghana UAC roadmap and other national programs. We have used a life course approach that has focused on improving maternal and child health services for the first 1,000 days and making sure that we focus on children, school-age child, adolescent, and adults, and not forgetting the age. For this, we are starting a wellness program to address emerging burden of overweight and obesity, and using existing primary health care as the platform for a comprehensive and integrated services. And we have used the maternal and child health record book that has been developed with technical and financial support from JICA. Next slide, please. Next. So as far as the book is concerned, it promotes quality of continuum of care and integrated services and empowers women and members of the family. We have used ANC as the platform to integrate quality services and nutrition counseling. This has used the WHO's systematic process of assessing, analyzing, and supporting the caregiver to make an appropriate decision. This has also adopted respectful, client-centered, and individualized care, and focusing on nurturing care messages to support early childhood development. And the book today has become an entry point for health and well-being. Next one, please. So for us, the nutrition counseling is a cardinal point of what we do. And this has been the process to address the existing regional and just disparities when it comes to addressing the challenges that are shared, and also focusing on the underlying factors of access and quality of care. And it has also provided the opportunity to look at some of the emerging food insecurities and vulnerabilities that the evolving COVID-19 pandemic has introduced. Next one, please. We have gone through an integrated implementation of nutrition, education, and counseling that is similar to the Japanese Shokuiku model. And this focuses on using simple illustrative messages, individual counseling that meets an individual household and mother's need, and will counsel on the expected weight gain for pregnant women so that their diets will be improved and ultimately the pregnancy outcome will be improved. Next one. So as I explained, the book has very illustrative pictures and simple messages, and it has also introduced a counseling table that supports the systematic introduction of messages and also guiding the mother and the other members of the family to support pregnant women and child nutrition. Next one, please. So more pictures that show the pictorial examples that is in the book, and guiding the mothers in simplified ways to improve their own nutrition and that of other members of the family. Next one. Next slide, please. Yeah, again, more pictures showing promotion of early initiation right from facilities and other households, and also promoted exclusive breastfeeding. What we see on the screen, with the book, we have introduced length measurement so that we can capture data on stunting early on, and also support teaching of the plotting and using the growth chart as a tool for counseling. Next one. So you can see a hands-on training where health workers are taken through practical training, and you can see examples of food items that we use based on the local available foods. Next one, please. Next slide. Yeah, and with the introduction of this book, we have introduced what we call the nutrition, can you go back, please? The nutrition counseling services. And this focuses on counseling to promote healthy diet of the mother and also promotion of appropriate, adequate, and safe feeding. And this is based on the record of the child, and it uses simple languages and based on the mother's socioeconomic background, considering what is affordable and practical in the mother or the family's background, so that they can actually utilize locally available foods. And it uses a very interactive process and encourages the mother to act And this is done in a way that avoids criticizing the mother or the family. Next slide, please. Finally, to strengthen what we have done, we are working with WHO and other partners, including JICA as well. And this process is strengthening the integration of essential nutrition services into primary health care. And we've gone through a process of situation analysis to assess policy and programs implementation and document bottlenecks and gaps. And the consultation has gone to a stage where we brought stakeholders together, validated our findings, and have developed plans to integrate the nutrition intervention into primary healthcare and UAC. And our expectation is that this will lead to a renewed advocacy and support actions that will improve outcome. And finally, some of the findings from the advocacy is integrated into the Ghana's commitment for the ongoing Nutrition for Growth Summit that will be presented on the 8th of this month. So I thank you sincerely for your kind attention. Thank you very much. Over.
Thank you, Ms. Amorfo, for letting us know of your efforts for integrating nutrition into UC. After good practice from the field, we would like to hear from UNICEF on their nutrition strategy and concept. So next, Ms. Maloney. Ms. Maloney is Senior Nutrition Advisor, Early Childhood Nutrition in the Program Group at UNICEF headquarters. Ms. Maloney, the floor is yours.
Thank you very much. I'm trying to put my slides on slideshow. There we go. So good morning, good afternoon, good evening, colleagues from around the world. I'm thrilled to be here today on such an important session in the lead up to Nutrition for Growth. And I'm delighted to present our UNICEF Global Nutrition Strategy, which is a 10-year strategy that will bring us to the SDGs in 2030. Now, our vision for our strategy is a world where all children, adolescents, and women realize their right to nutrition. And of course, it's guided by the Convention on the Rights of the Child. And we need to start with where we are in terms of global nutrition situation. So historic progress has been made in the last 20 years in child nutrition. We have reduced the stunting prevalence by 1/3, and that's resulted in 55 million fewer stunted children than in 2020. And we've made exceptional progress in breastfeeding, where we have 80 million more children exclusively breastfed today than we had in 2020. However, right now we still have a lot of work to do. At least 1 in 3 children is not growing well because of malnutrition. And this includes all forms of malnutrition, so not just undernutrition, it also includes overweight and obesity. At least 1 in 2 children suffer from deficiencies in essential micronutrients. And at least 2 in 3 children are not fed the minimum diet they need to grow healthy. So there is a lot of work to be done. New forces are driving the triple burden of child malnutrition and threaten to reverse those gains. And that includes globalization, urbanization, inequities, climate change, humanitarian crises, and of course, health epidemics, as we are currently living through right now with COVID-19. So our goal in the context of this situation is to protect and promote diets, services, and practices that support optimal nutrition, growth, and development for all children, adolescents, and women. And our strategy that will help us program and achieve that goal has been updated from, I'm sure, the strategy framework that many of you are aware that was developed in the 90s in Tanzania. And it has been updated to take into account the different elements of the strategy, and how they are interlinked. The universal premise of our nutrition program is that prevention of all forms of malnutrition comes first in all contexts, and if prevention fails, treatment is a must. And when we speak of prevention, we're talking of through the life cycle. So we're focusing on undernutrition, micronutrient deficiencies and overweight in early childhood, the same in middle childhood and adolescence, and the prevention of undernutrition, micronutrient deficiencies and overweight in women to prevent low birth weight in newborns. So that's three objectives. And then our fourth objective is to ensure the early identification and treatment of wasting and other forms of life-threatening malnutrition in early childhood. We use a systems approach to make 5 key systems, and those systems are food, health, water and sanitation, education and social protection, better equipped and more accountable to deliver diets, essential services, nutrition services, and positive nutrition practices for all children, adolescents and women to protect against all forms of malnutrition. As has been highlighted by earlier presenters, it's not sufficient just to rely on the health system. We need to also look at access and availability of food. And for those interventions, we need to draw heavily on the social protection and the education system and the food system. And of course, we need a safe environment with our water and sanitation system. So one example is how do we engage with the health system? So through the health system, excuse me, we aim to improve diets, services and practices. And an example is to support the scale up of essential nutrition services through the health system to both prevent and treat malnutrition, to build the capacity of the workforce to deliver these services, to ensure a sustainable and healthy pipeline for key nutrition supplies, to support information systems so we know what we're dealing with and the status of our nutrition interventions in our population, and of course to ensure reliable and sustainable financial resources for nutrition. We've embraced 6 strategic shifts to respond to the evolving face of child malnutrition across the world. So one is that we're focusing on all forms of malnutrition, not just undernutrition. We're focusing on the triple burden of child malnutrition. 2 is that we're applying a life cycle approach to our programming. So we start with early childhood, excuse me, school-age children, adolescents, and then through women's nutrition, so we can then intervene in the first 1,000 days. We're focusing on diet, services, and practices to improve nutrition outcomes. We're applying a systems approach, multiple systems, to strengthen capacity, accountability, ownership and sustainability. We're engaging on the private sector to play their role, making sure that they're being held to account to ensure healthy and nutritious food for all. And we're applying a vision and an agenda that's relevant to all contexts that can be applied in Japan, as well in contexts in Sub-Saharan Africa and Southeast Asia. So thank you so much for your attention. All of our documents are available on our website and the link is here, and I'd be happy to take any questions. Thank you, and Ms. Eby, over to you.
Thank you very much, Ms. Maloney, for your comprehensive presentation. And the goal is very clear: to prevent and promote diet, services, and practices around nutrition. The systems approach is also very interesting because it's very close with the multi-sectoral approach. Okay, so we will go to the Q&A and discussion session with the 3 speakers. So first, to Dr. Nomura, I'd like to ask about that Japan has been promoting the integration of nutritional services into maternal and child health services. What would be the success factors and necessary for adapting such system in developing countries?
Okay, thank you very much, Ms. Eby. I'm going to off the translation. So, okay, yes, it is true. The nutrition services in Japan are integrated into the MCH services. It's working very well, actually, but it's not enough to just take these good practices to all other countries and install them. So first and most importantly, the JICA attaches the great importance to the capacity building of human resources. So when JICA systematized the MCH handbook, for example, in some countries, we place the importance on capacity building on human resources to use it effectively. So, for example, in Ghana, the Miss Essie explained that we are training people who can use the MCH handbook to provide nutritional counseling. And also in the new project in Mozambique, we are also in the process of the developing MCH handbook. We will train not only the healthcare workers, but also the community volunteers. So in particular, nutrition is not the only the facility-based activity, but the community activity. So it's very much essential to address capacity building, the human resources in the community. And also, there is also challenges in Japan itself. I think it's the same in all countries, but usually the services for preschool children and school children are separated. So to address these issues, Japan has created a new law that allows seamless use of the children's health data for continuous monitoring. So I believe that the issue of how to connect the nutrition information to children up to the age of 5 to school age will become an issue in other countries. Thank you very much.
Thank you, Dr. Nomura, for your answer. And so I will go to Ms. Amofo. Why do you think Ghana has been able to achieve the integration of nutrition service into MNCH services? And what are the success factors and challenges?
Yeah, thank you very much for your question. I would say that one of the key success factors is being the existence of a well-established primary healthcare system. Ghana has a system that is well structured from central level right to the community level, we call the chip zone. So these structures are well laid out. And in going through the system of integrating nutrition into UAC, we've had to use a very participatory approach and established coordination mechanisms that has brought all key players aboard. For example, even though JICA is being the lead agency in supporting this process, we have also engaged key partners like UNICEF, WHO, and others, so that it is a comprehensive, all-inclusive approach to addressing this issue. Finally, we have also had to form partnership with non-traditional actors in health. And that has meant that everybody is around the table, although it has not always been easy to do that. At least it is owned by all the players, and they all come together at the various service delivery levels and contribute to the process of making it all inclusive, but also making it a multi-pronged approach, not only looking at what the Ghana Health Service or the health sector can do, but recognizing that the others have a critical role to play. On the challenges, again, as the first speaker explained, when you are trying to train so many health staff across the country, then there's a very high cost to that. And we are dealing with attrition of staff because they move and they come, so it has implication for sustained quality of services that we provide. Finally, there is a changing nutrition environment. You know, the whole world is becoming smaller, so things that we formerly didn't even have in our environment have been introduced. And as I said, so that, for example, is accounting for the increasing burden of overweight and obesity, and challenging us to also be more upcoming in communicating, so that the aggressive advertising for non-healthy foods, for example, would not be what people will hear, and they would get the information that comes from reliable sources from the health sector, but also community agents that are also part of the process. And I must say the opportunity to work with households and family as part of this has also been very helpful. Thank you. Over.
Thank you, Ms. Amorfo. I very much understand your efforts so far and also challenges you're facing. And okay, so I'd like to ask Ms. Moloney, what is the position and role of the health system and the health system approach to nutrition mentioned in the UNICEF's strategy?
Thank you so much, Ms. Eby. Yes, so as I mentioned in my presentation, we are working through engaging with different systems to apply approaches to improve diets, services, and practices to improve good nutrition. So the health system traditionally has been the home of most of these services. And examples of how UNICEF works through the health system are through ensuring essential nutrition actions for the prevention and treatment of malnutrition are available and at scale. Similar, for example, to our colleague from Ghana, if that child and that mother in that village is not getting services, we can have as many policies as we like, but it's not going to achieve the goal. So when we look at supporting the health system, it's about making sure nutrition is integrated into existing primary healthcare platforms and not established as a vertical separate program, because we need to take advantage of the fact that our mom is taking her baby to be vaccinated, is taking her baby to receive other information. So it's through those routine health contacts such as ANC, such as mother and baby clinics, that then we need to have essential nutrition actions. And those actions include providing counseling on good nutrition, on the importance of breastfeeding, on when to start complementary feeding, on growth monitoring, especially for children that we know are at risk or that are particularly vulnerable, the children that are born low birth weight, the children that may be living in food insecure or fragile contexts. So making sure we're monitoring their nutrition outcomes so that if they do begin to growth falter and they do begin to fall off their chart, that we intervene early. And then if they do unfortunately become wasted, that they have access to that treatment so that they can recover well. And in order to achieve a quality service, we need to have qualified professional staff and also community health workers. We need to have supplies that are available and that there's no disruption, that continuity is there. And those supplies include things like micronutrients, micronutrient powders, iron folic acid for mothers when they're pregnant, or more recently, multiple micronutrient supplements, and of course, ready-to-use therapeutic foods when we do have children who need treatment. But I think one of the most important interventions, and that often gets overlooked, is the access to quality, timely, and representative data. If we don't know what our situation is of our children and our mothers, then we're not going to know what they need, and we're not going to know how they're progressing. So investing in a high quality DHIS2, making sure core nutrition indicators are included, are being collected, are being reported, and are being used to inform programming is vital, so that the government knows where to put their resources. They need to know how their population are doing, and they can make sure that they are achieving the kind of work that they do. So there are just some examples of how UNICEF engages with the government to strengthen the integration of nutrition through the health system. Thank you.
Thank you, Ms. Maloney. The time is passing, but we have some questions from the floor. So I'd like to ask Dr. Nomura about the school's lunch system in Japan. And it has been criticized that it's increasing teachers' burden who are the busiest in OECD, with inequality expanding, burden to households increasing, and there are revealed its tenses, especially women. What is your opinion for issues?
This is the question for me. Thank you very much. It's very important questions. Yes, I will try to briefly present my thoughts. It's not easy answer, but at the moment there is certainly too much burden on teachers, I think, in Japan. I believe that we should think about the ways to implement not only nutrition education, but not only Shokuiku, but also the school lunches. We need to think about how to implement them together with the whole community, rather than leaving it to the teachers or mothers alone. So I will not introduce it today, but in Africa, the JICA has the project called School for All. School for All is implementing a school lunch program based on the community collaboration. So we may be able to learn from this example, I think. Thank you very much.
Thank you for your reply, Dr. Nomura. So let us go to the second session. Thank you to the three speakers. Thank you very much. And so we will talk about nutrition education and school feeding that can ensure healthy eating habits in the second session. First, I would like to invite Professor Swinburne to present on global syndemic and the viewpoint of the systems relating with nutrition. He is Professor of Population Nutrition and Global Health at the University of Auckland, New Zealand. So, Professor Swinburne, the floor is yours.
Thank you very much, and thank you very much for this opportunity to speak at this very important conference. So what I'm going to be talking about is at a much higher level than what you have been hearing and what you will hear about programs on the ground. And I'm going to talk about the global syndemic of obesity, undernutrition, and climate change. And if you don't know what a syndemic is, we'll come to that. But if you haven't heard of this before, then just think about how is obesity and undernutrition and climate change related? How do they relate to each other? So I'm going to tell you my main points first. We've already heard about malnutrition in all its forms, and this is the biggest cause of ill health and premature death in every single country in the world. And the amount of funding that goes into prevention of malnutrition in all its forms is actually tiny. And I think we need to lift that in relation to the size of the problem. The way that we think about it and the way we respond to undernutrition or obesity is operating in a silo, and we need to think about the underlying causes. And the underlying causes, I'm going to say, are very poorly designed food systems. So the global syndemic, this is a synergy of these pandemics of obesity, undernutrition, and climate change. And this is the paramount health threat of the 21st century. I'm going to finish by talking about the need for food systems transformation and thinking about the purpose of food systems. So malnutrition in all its forms, this is how the global burden of disease measures it. High body mass index, dietary risks, mainly for NCDs, and maternal and child undernutrition. Now, if you join those up together, how big is the burden of malnutrition in all its forms? And this is what it looks like at a global level, measured on disability-adjusted life years. And these are the top 4 risk factors for premature death and disease. And you can see that malnutrition in all its forms is by far the biggest cause. And if we look across levels of income of countries, then you can see no matter what the level of income of your country, malnutrition in all its forms will be the highest cause of disability-adjusted life years lost. And so here we've put them against the next 3 highest risk factors. Now you can see that the mix of what contributes to the malnutrition in all its forms changes. So low-income countries is mainly maternal and child undernutrition, which we've been hearing about. Higher income countries, it's obesity and dietary risks. So that's the first point, is that this is by far the biggest cause. The second point is that the amount of money that's invested in it, and here I'm just showing development assistance for health, and here are the funders on the left, the channels through which they go, and here is the funding for child nutrition as part of child health. But look at NCDs, non-communicable disease. This is where most of the deaths and disease cause in developing countries, and nutrition within this is almost invisible. So funding for obesity and non-communicable diseases, development assistance is almost invisible. And we have different mindsets for this. So in general, for undernutrition, it's seen as very urgent. There's a visible risk to life. The focus is nutrition as children and mothers, not enough calories. The individuals are not at fault, and the responsibility is a national and an international response, largely through feeding programs and some of these programs we've been hearing about. On the other hand, obesity and diet-related non-communicable diseases are seen as non-urgent. The risk to life is more invisible. It's older adults, it's too many calories. The individuals are considered to be at fault. This is a personal responsibility, individual responsibility. But if you want to do something about it, then it should be at the policy level. But often for funders and countries themselves, this is considered too political. And so there's a real challenge with implementing policies. But these forms of malnutrition, all the forms of malnutrition co-occur within countries, within villages, within the same households, and even within the same individuals. So we cannot afford to think about them separately with these different mindsets. And we need to think about all forms of malnutrition caused by food systems which are unfit for purpose. And so this is our mental model, if you like. In the center, we have the natural systems where we get our food, the human systems by which we devise our food systems. And this is what we want them to create: human health and well-being, ecological health and well-being, social equity, and economic prosperity. And just on that basis, then I want to talk about the global syndemic. So a syndemic is a synergy of epidemics which co-occur in time and place. They negatively interact with each other, and they have common underlying societal drivers. And so here we're talking about malnutrition in all its forms, plus climate change, because at least a quarter, even a third of the greenhouse gases are caused by agricultural food systems. So here is the global syndemic. Climate change has a negative effect on nutrition, undernutrition, and that has predisposes to obesity in later life. So we know those interactions. But more importantly, these are the drivers down here, especially the food system, transport, urban design, and land use. So if we want to make a difference to the global syndemic, we need to address these big issues, especially the food system. So we need a food systems transformation, and this starts with our mindsets, joining up these silos, thinking about them together as being caused by food systems which are poorly designed to meet those outcomes that we want. If you look at the current food systems in every country, they're built around two purposes. One is to feed people who can afford to pay, and the other is to create the livelihoods, profits, and export new. What we really want is our future food systems to restore environmental health and well-being, improve health and human health and well-being, promote social equity, and create economic prosperity. So there's a big picture for you, and thank you very much for your attention.
Thank you very much, Professor Swinburne, for your eye-opening presentation with a big picture at macro level in mind. And let us go to the examples at micro level. We will hear from Mongolia. Dr. Amejana Prejev is the Vice Director of School of Industrial Technology at the Mongolian University of Science and Technology. Dr. Prejev, over to you in 7 minutes.
Yeah, thank you. Good evening and good afternoon, good morning, everybody. My name is Puruch. I am professor of Mongolian University of Science and Technology. I am working on the school children nutrition and the developing school feeding system in Mongolia in last 20 years. I am pleased to participate in international webinar in introducing our about Mongolian school feeding system in current situation. This is contents. Now you see the needs of school feeding in Mongolia. Our school meal service is a little bit unique from other countries because Mongolia is the largest nomadic country in the world. Now about 30% of the population are living nomadic life, and herdmen's children are living in the school dormitory from the first grade until graduation, and it is necessary to improve dormitory catering service in school. Dormitory catering services used to be available and still operating normally. Now we need to create and develop new school lunch service. It is not possible to talk about school lunches and dormitory meal separately. In the former socialist area, kitchens were planned in almost all the schools, but only dormitory students could have a meal. This slide shows some statistical index related to health. Since 2013, among the children under 5 years of age, overweight and obesity increased. In 2017 report of WHO, children's overweight and obesity not decreased, almost the same. But still, we cannot start any intervention on this issue, such as how we decrease children's overweight and obesity. Drinking water services is very important for human health. You know, all of you know. According to WHO report, the monitoring disease, Mongolian indicator of drinking water is not good. And as you see now, National Nutrition Survey, some results. This is showing the main indicator for our children health. This is the percentage of children with vitamin A, D in iron deficiency, some malnutrition, school children. We hope that school feeding will be improved nutritional status of school children, such as overweight and deficiency, some the major nutrients. And 2019, spring, our parliament was passed the school feeding law. It is very important issue for the future. School feeding will be very important intervention for every children's health, including weight gain, because in our country, school enrollment is very high. About 98% of all school-age children attend school. It means that every children could enroll to school. So school meal could be influenced for the children's health. We hope that this school meal program could be influenced for every children in every family. I talked before, I explained the views of school feeding in the past time. At that time, mainly focused on dormitory meal service. Today, by the law, we focus four target issues. This food supply. This is time. In this time, we try to develop local food system, how to develop school gardening. All the school children must get meals at the school. Every grade children can get meals at the school by the law. The cost of all expenditure of school feeding will be covered by Mongolian government. One of major activities is how to spread nutrition education. And just we need to very lot of funding and technical assistance to implement the law successful. Just approved law, JICA was paid great attention because JICA was the first international support for us. We are very pleased that the JICA project will be completed very quickly and will be implemented from this year, 2021, which will greatly support the implementation of school feeding law in Mongolia. The school feeding law is foundation. It is my conclusion. The school feeding law is the foundation for the future success program. It is necessary to create and develop most appropriate system that is being best suited for the condition of the country. It is possible to most sustainable program to support for growth and health in Mongolian children in the future. Thank you for your attention.
Thank you very much, Dr. Prejev, for your wonderful presentation. It's very practical and can be a food for thought for other countries. So next, last but not least, I would like to invite Ms. Maleko, coordinator of Sun Business Network Tanzania, presenting on school feeding through public-private partnership. So Ms. Maleko, the floor is yours for 7 minutes, please.
Okay, thank you very much. Hello, everyone. My name is Haika Maleko. I'm the Sun Business Coordinator based in Tanzania. And I'd like to talk about the public-private partnership in Tanzania in implementing the school feeding program. Particularly, I'll talk the contribution on how the private sector can work with civil society organization. And I will use that, I'll use an example of this pilot project that we did last year from the Sunpool Fund. What's the background of the project? The project had the key objective of improving the diets among the school children through increasing the access of fortified food to 12,000 school children among the 30 schools located in 2 regions in Tanzania, Tanga and Kagera. We chose those 2 regions because they had high rate of malnutrition, but also in those regions had few development partners in comparison in other regions which has more development partners. In terms of the outcome of the project, it was more about increasing the access of fortified school meals in school through working very closely with the private sector, but also strengthening the stakeholder coordination at subnational level within 2 regions. We mean at district, ward level, and also at the community level. The other part was to create knowledge that can be shared with other regions that are interested in implementing or scaling up such program. So in this project, how did we work to achieve the intended results? So we work, we build the capacity of the private sector. In this sense, we work very closely with millers on the supply of fortified food in these schools, but also we build the capacity of schools to understand why they should eat nutritious food, particularly fortified flour, but also work very closely with the local government authority, both at the regional and district level, so that they can get understanding of nutrition, fortification, and how they can implement it at school. The other part that we did, we link schools and private sector so as to ensure that there is consumption of nutritious food. So this project, as I said earlier, it was done for 1 year. And we work with various stakeholders in this project. We work with the government, we work with civil society organization, but also we work with private sector. So in terms of the government, we work with the San Focal person who was the coordinator of this project, who sits under the Prime Minister's office. We also work with the President's office responsible for our regional and local administrative authority for both 2 regions. We also work with the civil society organization. In this case, we work with the Partnership for Nutrition in Tanzania, who were responsible for the advocacy part. We also work with schools. We also work with the private sector company called ONA, which was responsible in doing the advocacy at the school level. So what were the main results of the impact of this project? So this project particular, we achieved a lot of things, but the main key achievements were to increase the nutrition awareness to the private sector. So we mean the SMEs that they work in this region, the SME that supply food to schools in this region, but also increase the awareness to government officials on the nutrition in terms of also the monitoring. How can they monitor the food safety of the food, that is the food safety for this produced by the private sector in those regions. But also we increase the nutrition awareness for the millers so they can understand the nutrition components of the food that they produced. The other achievement that we did, we managed to establish leadership clubs, 30 leadership clubs in those 30 schools that we work with. Mainly was to engage youth in nutrition matters in schools. I'll talk a bit later in the next slide. And the last but the big part was to create linkages between the schools and suppliers to ensure that these schools, they continue to eat nutritious food when the project phases out. So the key result was more about the increasing the supply of the nutritious food. That means, we mean the fortified maize flour that we were working with, but also we increased the consumption in those regions that we work with. And that last thing that we also managed was to create the leakages in the supply chains between the schools and millers to ensure the continuity in the supply of fortified food. If we go to deep dive a bit about the school clubs, so as I said earlier, these were the leadership clubs. These are a group of students that they voluntarily joined to discuss on nutrition matters and put them into practice. And in this project, we work with a private company that's called ONA, who was doing the capacity building to schools, management team, but also students to ensure that they understand nutrition and how can it be practical in the environment. So the activities of these leadership clubs, which were established, were mainly on providing training to students on nutrition, and its impact, but also to establish small gardens and also educating the surrounding vendors to school on how they can supply the healthy food instead of junk food. So what are the challenges of implementing the school feeding program Maternal is taking? So as we can see, most of the school feeding, they depend on donation, but also parents' contribution. There's also big weak linkages between the school private sector and CSOs in this region. And we also note that the policies and guidelines on feeding, they are not widely known at regional level, at district level, but also there's still low awareness of importance of nutrition among various partners at subnational level. So thank you. Thank you very much. Over.
Okay, thank you, Ms. Maleko, for your presentation on the details about the actual practice of the public-private partnership for school lunch program and also challenges in the field. Okay, so I'd like to go on to the Q&A session with the three speakers. So first, I'd like to ask to Professor Swinburne, what do you think is the role of school feeding in creating a food environment for children? How do you see the potential of nutrition education to overcome global pandemic?
Thanks very much, and I think that's a great question. I think a school food program, can be what we call a triple duty action. In other words, it has an effect on preventing undernutrition, on preventing obesity, and also in sustainable eating and helping to prevent in climate change. Now, that's the last part. The climate change is more of a burden for the high-income countries to reduce their climate footprint, their greenhouse gas footprint. But nevertheless, a school feeding program is a very powerful tool. It's a lot of money coming from a government, and it creates a lot of leverage. And I think it's not just education and program, but I think, as you showed in the example of Japan, and I think as we have seen with the multi-stakeholder engagement, it's really about changing the culture around food. The whole purpose of food is to nourish the children, and it's not, if it's seen as a burden on teachers and it's seen just as something that you wheel in to feed kids, it's not going to get the same results. And I do think those early statistics you showed of Japan, where the reduction in undernutrition has occurred, but that's not unusual. Most wealthy countries have that, but Japan has managed to escape the obesity epidemic to a large degree. And I think that's because of the embedded food culture within Japan. And I think that's what we need to be aiming for. So school programs can really be important in embedding that within the food culture and the meaning of food, not just a feeding program.
Thank you, Professor Swinburne, for your comprehensive reply. And also you mentioned about the Japan's experience. Okay, so I would like to ask to Dr. Prejev or her colleague, what are the success factors for establishing the School Lunch Act in Mongolia? What are the challenges and expectations ahead?
Thank you for your question. Yeah, our success factors for establishing a School Lunch Act. It is a very big way we need to big time. Since 2000 years, we started to present some results of school lunch system of foreign countries such as Korea, Japan, USA, and how it is important children's nutrition for their health and growth. organized several national seminars, and also implemented different models of school lunch, such as city, IMAC, and some level. This urban and rural schools condition is a bit different, and in all of models, we have maybe 5 and 10 models we implemented, and all of the results of schooling our models was very good. And after the community recognized it to improve nutritional status of children by the school areas in some kindergartens, and thus we can approve by the parliament our law in the 2019. And we have several challenges to setting up school feeding systems. The actual situation is each school's condition is different. I said before, for example, schools is capital city and rural city and a little bit town, and we named it SOM. It is very very different. Therefore, it is necessary to create food supply system. Post challenges, I think it is how to create the food supply system and suitable for the local area. It is very important, and we need to children serve local food. It is very important. This is shortage of professional kitchen staff in rural areas. Professional kitchen staff is very important things, important problems, and there are not. We have a few challenges like this one, and so many I can say. And finally, there will be food supply system, how we develop school, every school, each school in kitchen, how to spread nutrition education system for the population, especially children and school teachers and their parents. This is some changes.
Thank you, Dr. Puruch, for your reply. Actually, we have a related question from the audience. And so you mentioned about the kindergarten. So you are going to expand to preschool or secondary or tertiary schools. Dr. Puruch? Dr. Puruch, can you hear me?
Yes.
Are you planning to expand the school lunch program to the kindergarten and also secondary or tertiary schools?
Yeah, schools, not kindergarten. And we need to, our school children cannot eat, cannot serve at the school any meal service. And we need to develop school meal service, school feed, only school feed. Yes.
Okay, thank you for your reply. Okay, so I would like to go to the Ms. Maleko about in Tanzania. How do you manage the school lunch program with public-private partnership? What are the ways to sustain the school feeding in the region?
So, I mean, in the region, particularly in Tanzania, using the pilot project that we did in Tanga and Kagera, we work with the private sectors, we mean the supply and the government, to implement this project. With the government, it's more on reinforcement of the policies and procedure of the school guideline, but also doing the monitoring. We need to monitor the food safety of that's being fed to the kid. For the private sector, what we do, we provide the capacity building by providing the right technology that they need to produce the nutritious food. We also work them to facilitate the procurement process of the quality food, but also we work with private sector to train them on the required standard regulation and food safety. On the other aspect, on how we manage work with them, we work and support the sectoral nutrition committee at the regional and district level to monitor and reinforce the school feeding directives that has been set by the government recently. The other thing that we do, we link the suppliers, we mean the millers, to the school procurement system so that they can have the access to the nutritious food. And how we can sustain the school feeding in the region mainly is to reinforce of the guideline on the school feeding that has been set in the directive, both at the regional, district, and also at the community level. We also work with the government on the regular monitoring by the government regulatory authorities and also education officer, but also linking the millers and the schools procurement system to ensure that there's that supply of nutritious food to school. Thank you.
Thank you. Thank you, Ms. Maleko, for your reply. And we have a question related with your reply. And what kind of safety net in case that the private sector change their mind to withdraw later?
Sorry, safety?
Safety net, safety guard. How do you prepare for in case the private sector change their mind to withdraw?
Well, the safety guidelines have been set by the regulatories in Tanzania. So they are required by the law to comply, you know, and we support the government to do this regular check. So if they are found with not following these safety, then they will be kicked out of the business, like not be able to, you know, to supply food to schools. Yeah, so these safety guidelines are also being set by, you know, the government regulatory agencies here. For example, in Tanzania,
Thank you.
yes.
Yeah, so you have the safety guideline for the private sector to comply with. So how can you manage if you if the private sector change their mind and withdraw from the service?
Then we work with the government to ensure that, you know, they comply with the service.
Yeah, thank you for answering with the difficult question. Okay, so we have one more question to Professor Swinburne. What are the good practice and or challenges of collaboration between education and nutrition sector, you know, among different ministries and agencies?
Yes, well, I don't know about in your country, but in our country, they don't necessarily talk to each other. And so I think there's often silos of activities within government, and it's quite often difficult to bridge. But I think a school feeding program can be a very helpful bridge to that. But it does come down to the whole issue of the food culture and whether the education system believes it has a role in health and child well-being. If it does, it makes that collaboration much easier. If they think they're just there for teaching and not the wider welfare of the child, that makes it much harder.
Thank you for your insights and also examples. Okay, so we are coming closer to the end of this side event. So as a conclusion, I'd like to conclude this event by summarizing the key messages of the session. Okay, we have 3 points. The first is nutrition contributes to protect not only life, but also growth of children. To realize this, the quality of nutritional services matter, which is integral in the health services, as presented with Ghana's experience. We need to take systems approach, which consists of several systems, such as social protection and health system. And the second point is that the quality of diet can also differentiate also health of children. After the first 1,000 days, children grow in communities. So it's a key to develop healthy food environment for children in view of food system and even climate change. School feeding has a great potential to that effect, as we see governance in Mongolia and also examples of the public-private partnership in Tanzania. The third is that for creating an environment which overcomes triple burden of malnutrition and global pandemic, it's crucial to work on the entire society with systems approach rather than just relying on individual efforts. These are the conclusions of this event. Okay, so we are coming to the end of this event, and the record of this event is made public via YouTube through JICA's homepage. So we are looking, so please look at it. And also thank you very much for the questions raised from the audiences. We haven't answered all of them, but we answered to some of the questions you raised. Thank you so much. So please put your hands together to all the 6 speakers for their wonderful contribution to this event. Thank you very much. And bye-bye.
Bye.
Thank you.
Thank you for the opportunity.
Thank you. Bye-bye.
Thank you. Bye.
Bye.